So let's use 2 minutes to learn the review area of CT orbits. So first of all is the axial soft tissue window. We first take a look at the bilateral globes. We should see very smooth and also intact contour of the bilateral globes. And within the globe, we should not see any hyperdensity to suggest hematoma. The bilateral lens, the position should be symmetrical. The relative depth of the anterior and also posterior chamber should also be symmetrical as well. And then we take a look at the bilateral optic nerves, whether they have normal contour, whether they're intact, and also any abnormal compression or any mass arising from the optic nerve such as meningioma. And then eventually we can also take a look at various parts of the extraocular eye muscles. One thing that is especially advantageous on axial plane is whether there is expansion relatively spare the tenos junction. Okay, this will be very classical for Graves' ophthalmopathy. Okay, and then also the bilateral retrobulbar fat plane. Whenever we have hematoma or even inflammation of all the soft tissue, including optic neuritis, there can be stranding. Okay, and then take note of the bilateral wall of the bilateral orbits, including the ethmoid bone and also the greater ring of sphenoid as well as the zygoma. And whether the patient have exophthalmos, we can make use of interzygomatic line, where we have the zygoma. You can see here. Okay, and then eventually you can draw a line like this in the zygomatic line, and then try to compare the most anterior aspect, whether it is smaller than 23 millimeter. Then there is no exophthalmos. Okay, and then most importantly, we always take note of the coronal plane. Try to see where there is crowding of the orbital apex, which will compromise the visual acuity. And then also any dilated superior ophthalmic ring, which signifies some problem regarding the drainage. For example, the duodenal sinuses, okay, any thrombosis, any pathology there. And also we can notice the superior wall and also inferior wall. Sometimes there is orbital blowout fracture involving the floor, and then there is herniation of the fat and also extraocular eye muscle there. This may also happen to the lamina papyracea, which is the thinnest part of the orbital wall as well. So take note of all these features, and then next time you can screen that very effectively, especially in trauma setting.